Imagine taking a medicine every day, trusting it to relieve pain or discomfort, never realizing it may be slowly damaging your kidneys. A senior Japanese nephrologist once said something that shook the medical community. Most kidney failures in seniors are not sudden. It is silent, gradual, and medication-driven. For people over 60, kidneys naturally lose about 1% of filtering capacity every year. That means what was once a safe medicine at 40 can become dangerous at 60 or 70. Today, we will talk about 6 very common medications that have been repeatedly linked to kidney damage in people over 60. These medicines are familiar, trusted, and often taken without second thought. If you are over 60 or you love someone who is, please stay with me. This knowledge can protect years of kidney life. Most seniors did nothing wrong. They trusted medicines that were meant to help them feel better and live comfortably. After the age of 60, kidneys naturally lose strength. Blood flow slows down, filtration becomes weaker, and recovery after stress is much slower. A medicine that felt harmless at 40 can become dangerous at 60, even at the same dose. What makes this frightening is that kidneys do not cause pain and early damage. There is no burning sensation, no sharp discomfort, no loud warning sign. Life continues normally while kidney function quietly declines in the background. Many people only discover kidney loss when swelling appears, urine output changes, fatigue worsens, or routine blood tests suddenly look abnormal. By that time, much of the damage cannot be reversed. This is not about fear meant to scare you. This is about care meant to protect you. Let's talk about the biggest hidden offender. 1. Painkillers risk. Pain relief medicines are among the most trusted drugs in daily life, especially after the age of 60. Many people take them to manage knee pain, back pain, arthritis, headaches, or body stiffness that comes with aging. These medicines provide quick comfort, which makes them feel safe, familiar, and necessary. What most people do not realize is that inside the body, these medicines quietly interfere with how the kidneys protect themselves. Kidneys rely on steady blood flow to filter waste and toxins safely. Pain relief medicines reduce the production of protective substances that keep kidney blood vessels open. When these substances are blocked, blood flow to the kidneys decreases. With less blood reaching the filters, kidney cells receive less oxygen and nutrients. At first, the damage is small and invisible, but repeated exposure turns temporary stress into permanent injury. After the age of 60, kidneys are already working with reduced reserve. Filtration capacity naturally declines, and recovery after stress becomes weaker. When pain relief medicines are taken regularly, even at normal doses, the kidneys struggle to adapt. Each dose adds pressure, and over time, the filters begin to scar. This scarring reduces the kidney's ability to remove waste, regulate fluids, and balance electrolytes. What makes this situation dangerous is how silent it is. Pain relief works well, so the body feels better. There is no kidney pain to warn you. No immediate burning, no sharp discomfort, no sudden symptom. Many people continue taking these medicines for months or years, believing they are simply managing pain. Meanwhile, kidney function slowly declines in the background. The risk becomes higher when pain relief medicines combine with common conditions like dehydration, high blood pressure, diabetes, or heart disease. Many seniors drink less water either due to reduced thirst or fear of frequent urination. This concentrates the medicine in the bloodstream and intensifies kidney stress. Protein may begin leaking into the urine, a sign that kidney filters are breaking down faster than expected. This is where fear naturally appears, but it should be balanced with hope. Pain should not be ignored, and comfort matters deeply. The key is awareness and protection. Avoiding daily or long-term use without supervision can significantly reduce risk. Using the lowest effective dose, staying well hydrated, and monitoring kidney function regularly helps preserve kidney health. There are safer approaches to pain management for seniors. Gentle movement, heat therapy, targeted exercises, weight management, and doctor-guided alternatives can reduce pain without stressing the kidneys. Some pain treatments work locally rather than through the bloodstream, placing less burden on kidney filters. If you are listening and thinking about someone you love, this information matters. Many people damage their kidneys while trying to live comfortably. Pain relief should never quietly steal kidney life. Awareness today can protect years of kidney function tomorrow. 2. Acid blockers. Acid-controlling medicines are some of the most commonly used drugs in people over the age of 60. Many start taking them for heartburn, indigestion, chest discomfort, or stomach irritation. At first, the relief feels almost magical. Burning settles down, sleep improves, and eating becomes comfortable again. Because they work so well, many people continue using them daily for months or even years without questioning their long-term impact. Inside the body, these medicines strongly suppress stomach acid. While this helps symptoms, it also changes how the body absorbs minerals and processes waste. Over time, this creates hidden stress on the kidneys. One of the most concerning effects is slow inflammation inside kidney tissue. This inflammation does not cause pain, fever, or warning signs. It quietly scars the kidney filters, reducing their ability to clean the blood properly. After the age of 60, kidneys are already more vulnerable. Filtration slows naturally, and the ability to recover from inflammation becomes weaker. When acid blockers are used continuously, kidney cells may remain in a constant low-grade inflammatory state. This repeated stress gradually reduces kidney function, often without the person feeling anything unusual for a long time. Another important issue is mineral imbalance. Long-term acid suppression reduces absorption of magnesium and sometimes calcium. Low magnesium levels increase kidney stress and also affect muscles, nerves, and heart rhythm. As mineral balance weakens, the kidneys work harder to maintain internal stability. This added workload accelerates kidney fatigue in seniors. Digestion also changes when stomach acid remains suppressed for too long. Protein breakdown becomes less efficient, which increases metabolic waste in the bloodstream. The kidneys must filter this waste, adding further strain. Many people notice fatigue, weakness, or poor appetite, but never suspect their stomach medicine could be part of the problem. What makes this emotionally difficult is that many people were never meant to take these medicines long-term. They were often prescribed for short healing periods. Without review, weeks quietly turn into years. Comfort slowly becomes dependency, and kidney stress continues unnoticed. This does not mean these medicines are evil or should never be used. They are valuable when needed. The key is duration, monitoring, and awareness. Using them for the shortest effective time, reassessing symptoms regularly, and checking kidney function can dramatically reduce risk. There are gentler ways to protect digestion while protecting kidneys. Eating smaller meals, avoiding late-night heavy foods, managing stress, improving posture after meals, and addressing root causes can reduce acid symptoms naturally. Sometimes dose reduction or intermittent use under medical guidance makes a meaningful difference. If you are listening and thinking, I take this every day, pause with care, not fear. Awareness gives you control. Protecting digestion should never quietly harm the kidneys that protect your life every day. 3. Antibiotics danger. Antibiotics are life-saving medicines, and many people rely on them to fight infections, especially after 60. A cough, urinary tract infection, or chest infection can quickly feel dangerous without treatment. The problem is that certain antibiotics, if not used carefully, can quietly put serious stress on the kidneys. Many people do not realize that older kidneys process drugs more slowly, so what might be safe at a younger age can become harmful later in life. Inside the kidneys, some antibiotics accumulate in the tiny filtering tubes. Over time, this causes inflammation and damage to the delicate structures that clean the blood. Initially, the stress is subtle, almost invisible. There is no pain or alarm, just a silent burden building in the background. Repeated exposure can leave permanent scars that reduce filtration and weaken the organ's ability to balance fluids and remove toxins. The risk is higher when infections occur alongside dehydration, high blood pressure, diabetes, or other medications. Seniors often drink less water when sick, which concentrates the antibiotic in the bloodstream. Even mild dehydration can multiply kidney stress. Early signs like reduced urine output or slight swelling are easy to miss, while fatigue is often blamed on age or illness. This can feel frightening, but there is hope. Antibiotics are important, and infections must never go untreated. The key is careful use, proper dosing, adequate hydration, and monitoring kidney function during treatment. Shorter courses at the right dose can be effective while reducing risk. Doctors can adjust medicines based on age, weight, and kidney strength, which makes a big difference in protecting kidney health. Alternatives also exist in some cases. Mild infections may respond to other medications or supportive treatments under guidance. Strengthening the immune system through rest, hydration, proper nutrition, and gentle movement helps reduce the severity of future infections. Being proactive and attentive to early warning signs, like sudden fatigue, swelling, or changes in urine, allows intervention before permanent damage occurs. What makes this situation emotional is that people trust these medicines to heal them. They never expect them to slowly harm their kidneys while fighting illness. Awareness and careful supervision allow you to use antibiotics safely without quietly compromising kidney function. Taking control today ensures your kidneys continue working for you tomorrow, so that life stays healthy, active, and full of energy. 4. Diuretics risk. Diuretics, often called water pills, are commonly prescribed to control blood pressure and reduce swelling. They help the body remove excess fluid, which can protect the heart and lungs, but they can quietly put stress on the kidneys if not used carefully, especially after the age of 60. Many people rely on these medicines daily without realizing that taking too much or not balancing fluid intake can strain kidney function over time. Kidneys depend on a delicate balance of water and electrolytes to filter blood safely. When diuretics remove too much fluid, the kidneys can become underfilled, reducing filtration and allowing waste to accumulate in the bloodstream. This process does not usually cause pain, so many people continue taking the medicine without noticing any warning signs. Over months or years, this repeated stress can damage kidney tissue, leading to decreased function and a higher risk of complications. Seniors are particularly vulnerable because natural kidney function declines with age. The ability to adapt to fluid changes becomes weaker, and the risk of dehydration increases. Many people fear frequent urination, so they intentionally drink less water, unknowingly worsening kidney strain. Electrolyte imbalances, including shifts in sodium and potassium, can also occur, placing additional pressure on the kidneys and affecting heart rhythm. The good news is that diuretics can be used safely with awareness and proper care. Monitoring fluid intake, drinking enough water, adjusting dosage with medical guidance, and regular kidney function tests help reduce risk. Staying alert to subtle signs such as mild swelling, unusual fatigue, or changes in urine output can allow early intervention before permanent damage occurs. There are also lifestyle strategies that can reduce reliance on diuretics. Reducing salt intake, maintaining a healthy weight, gentle exercise to improve circulation, and supporting heart health through diet can all help manage fluid balance naturally. Doctors may also adjust medications or combine therapies to lower risk while maintaining effectiveness. What makes this situation concerning is that the intention behind using diuretics is health protection, not harm. People want to prevent swelling, maintain blood pressure, and stay active. Yet without care, the medicine itself can slowly compromise kidney function. Understanding this risk allows seniors to use diuretics wisely, protecting both heart and kidney health. If you are watching, remember that awareness and action today can prevent silent kidney damage tomorrow. Proper hydration, regular checkups, and honest discussions with your doctor ensure these medicines continue to help rather than harm. Your kidneys work tirelessly for you every day, and protecting them is one of the most important things you can do for your long-term health. 5. Contrast dyes. Imaging scans like CT or MRI can save lives by detecting serious health problems early, but the contrast dyes used in some scans can quietly harm the kidneys, especially in people over 60. These dyes are chemicals that improve the clarity of the images, but they also temporarily reduce blood flow inside the kidney filters. When blood flow drops, the delicate kidney cells receive less oxygen and nutrients, which stresses the organ. Over time or with repeated exposure, this stress can cause lasting damage. The damage happens because contrast dyes increase oxidative stress in the kidneys. The tiny filtering tubes, called nephrons, are very sensitive to changes in blood flow and chemical stress. When exposed to contrast, some kidney cells may die or scar. This reduces the number of functioning filters and slowly decreases the organ's ability to remove waste and maintain fluid and electrolyte balance. At first, the body may show no symptoms, which makes the damage easy to miss. Many people only notice it later through elevated creatinine or decreased urine output. Seniors are particularly vulnerable because natural kidney function declines with age. Conditions like diabetes, high blood pressure, dehydration, or pre-existing kidney weakness make the kidneys even less able to handle the chemical stress of contrast dyes. This is why a routine scan can sometimes trigger acute kidney injury if precautions are not taken. The good news is that the risk can be significantly reduced. Doctors often recommend drinking plenty of water before and after the scan to keep the kidneys hydrated and to help flush the dye. Using the lowest effective amount of contrast and spacing scans apart can also reduce cumulative stress. Monitoring kidney function before and after imaging is essential to catch any early signs of damage. Alternatives exist for some conditions. Ultrasound or non-contrast scans may provide the necessary information without exposing the kidneys to harmful chemicals. When contrast is necessary, protective strategies like intravenous fluids and careful medical supervision help reduce the risk of injury. What makes this situation concerning is that the intention behind the test is protection, not harm. Patients undergo scans to detect disease early, yet without awareness, their kidneys may pay the price. Understanding the potential risk allows people to ask questions, take precautions, and ensure their kidneys are shielded while still benefiting from vital medical imaging. If you are watching, remember that knowledge is protection. Preparing for scans, staying hydrated, and discussing kidney health with your doctor can make all the difference. Contrast dyes do not need to be avoided entirely, but used wisely, they will help without quietly damaging your kidneys. Protecting your kidneys ensures that they continue filtering your blood safely every day. 6. Herbal risks. Many people believe that natural or herbal products are completely safe, but some of these medicines can quietly harm the kidneys, especially after the age of 60. Certain herbal supplements contain hidden toxic compounds or heavy metals, which the kidneys must filter from the blood. Over time, repeated exposure to these substances can cause inflammation, scarring, and permanent damage to the delicate kidney tissue. The danger is often silent, with no immediate pain or warning signs, making it easy for people to use these products daily without realizing the harm. The kidney damage occurs because the kidneys are responsible for filtering everything that enters the bloodstream. Unlike the liver, which can detoxify certain compounds, the kidneys cannot neutralize toxins. Herbal products with harmful chemicals can accumulate in the kidneys, increasing oxidative stress and causing cell injury. Seniors are especially vulnerable because kidney function naturally declines with age, and recovery from cellular stress becomes weaker. Prolonged use can gradually reduce the organ's ability to filter waste, regulate fluids, and maintain electrolyte balance. Some herbal products can also interfere with blood pressure, interact with prescription medications, or worsen dehydration, which adds extra strain to the kidneys. People often take these supplements to improve energy, support immunity, or relieve pain, believing they are harmless. This trust, while natural, can allow serious kidney stress to build quietly over time. The good news is that this risk can be managed. Awareness and careful selection are key. Always check ingredients, avoid products with unknown chemicals or heavy metals, and consult a doctor before starting any supplement. Limiting use to short periods, monitoring kidney function regularly, and staying well hydrated helps reduce the burden on the kidneys. There are also safer alternatives to support health naturally. Balanced nutrition, proper hydration, gentle exercise, and lifestyle habits like sufficient sleep and stress management can provide energy and immunity support without putting kidneys at risk. In some cases, doctor-approved supplements with verified purity and dosage can be used safely under supervision. What makes this situation emotional is that people take herbal products with the intention of helping their body, yet the very organ responsible for cleansing the blood can suffer silently. Understanding the potential danger allows seniors to use these products wisely, protect kidney function, and continue supporting overall health safely. If you are watching, remember that natural does not always mean harmless. Careful choice, medical guidance, and vigilance can protect your kidneys while still enjoying the benefits of health supplements. Every action taken today can preserve kidney function and help you live a healthy, active, and energetic life for years to come. Your kidneys work silently every day, filtering your blood, balancing fluids, and keeping your body alive. After 60, they become more vulnerable, and many common medicines can slowly harm them without warning. The good news is that awareness gives you control. By knowing which medicines can be risky, monitoring your kidney health, staying hydrated, and discussing alternatives with your doctor, you can protect these vital organs. Do not wait for a warning sign to act. Every small step you take today, from checking doses to making lifestyle changes, can preserve kidney function and prevent future complications. Share this knowledge with your loved ones because awareness saves lives. Take charge of your health, ask the right questions, and make kidney protection a priority. Your kidneys give you life every moment, and it's time to return the favor.